In the United States, an estimated 5.4 million people are living with Alzheimer's disease, and someone develops the disease every 69 seconds. There are nearly 15 million Alzheimer's and dementia caregivers, providing 17 billion hours of unpaid care. More than 60% of family caregivers report high levels of stress because of the prolonged duration of caregiving, and 33% report symptoms of depression. Volunteers at the First United Methodist Church in Burnet, Texas, are there to help.
We are giving a respite time for families and their loved ones that take care of people that have dementia and Alzheimer's.
It started in November 5 years ago, and we've had clients the entire time. Our program isn't very large, but we have been able to have offshoots from this program now in Marble Falls and Llano. So it has grown for the Highland Lakes area.
We give them a little break because if you've ever had a loved one or known a family that has this in their family, it's extremely difficult to deal with. You love the person, but they're not there any longer. It's the disease that has taken over, and it's very, very difficult to help these people because you love them so much, you hurt for them, and you can't fix it, and it's very hard. So what we do basically is we take mothers, fathers, even children that come in, and we give that family member 4 hours of respite per week. We serve a light breakfast, and we have some crafts and some music and some chair exercises, and we just kind of keep them entertained. It's good for their mental status. It helps them to relate with different people. It's just a really good program.
It's very easy to get a program started. People say, what can I do? Let me bring some games. Well, everybody's got things at their house that they never use. They have craft items they never use. It's just a matter of getting the people, someone in charge of putting the kitchen together, someone in charge of meals, someone in charge of crafts, someone in charge of music, and so on and so forth. And then it just kind of grows from there.
In our church, when I brought the request to our trustees, they had a lot of questions, and well, they should have, about the care and responsibility of the patients. And so they agreed. I had our missions committee, and so they agreed if I would be the liaison between the church and the respite program, they would be comfortable for bringing the program in. And our congregation is very supportive. They help with a meal once a month, and we've gotten our volunteers, like Mary Jane, is a member of our church, and we're just fortunate to have her as the director of the program.
Actually, the Alzheimer's Association in Texas helps assist. They give us training. They have one-on-one Alzheimer's learning groups. They give programs to caregivers on a regular basis, so they are a great resource.
The respite programs are so fantastic when you've got somebody at home and you're trying to take care of them 24 hours a day to give you relief that you can get out and do something just for you, which is terribly, terribly important. It was also great that he could come home and talk to me about what they did at Respite, so we had a basis of conversation that wasn't what we'd both been doing together all day, but it also gave me a chance to participate in things that I wanted to do.
Getting it started is not hard. The rewards are tremendous. It is a tremendous ministry for the church. And it's a tremendous ministry for families and for the participants. The participants look forward to coming. This might be the only day of the week that they are out.
If your church is interested in starting a respite program and would like some guidance, contact Mary Jane Shanes or Marjorie Bronk at First United Methodist Church in Burnet, Texas, or the Alzheimer's Association in San Antonio at 210-822-6449.